Welcome into The Fixers. I'm Jeremy Kahn from 105.7 The Fan. The Fixers is brought to you by the Orthopedic Associates of Central Maryland, a division of Centers for Advanced Orthopedics, and we're here joined by Dr. Oren Blam.
Good morning.
Good morning. So, first off, tell everybody about yourself and the type of doctor you are, because this fits right into what my issues are. So I'm excited to talk to you.
Oh, my pleasure. My name is Oren Blam. I'm an orthopedic spine surgeon. That means I'm an orthopedic surgeon who subspecializes in spine problems, the non-operative and surgical treatment of spine conditions.
So a guy like me, for years, it's been, I think I was suggested to have back surgery about 9 years ago, and you get scared away from the people you talk to. It's this, 50% of the people had a good time, a good experience, 50% didn't, and it all matters, the numbers, but you're here to tell us that's not necessarily the case.
Well, it's true. I think the key to having a good outcome with really any medical treatment, including surgery, is making sure we have diagnosed the problem correctly and then chosen the right solution for the right problem. So surgery is an option that has very high success rates in the spine as well as elsewhere, but only when we've really solved what the problem is and we've gone through other treatments first, typically.
So with my issue, and I'm sure you see a ton of lower back, and what's typically the resolution for most people with lower back issues like I have?
Low back pain is one of the most common problems that people have in America, probably second only to the common cold. It's a universal thing that people have back pain. And most people, over 90% of people, will get better with non-operative care. But a small subset of patients have anatomical problems that just don't get better after a lot of different types of non-operative treatments. And that's where surgery can be very helpful.
Yeah, and that's what I went through. So to go back to 2010, when I was first kind of diagnosed with a herniated disc, I had a severely herniated L4, and I had a tear in my L5. And over time, I remember getting my first MRI, and the news comes back, and I was nervous about what it meant. But over a period of time, I've actually herniated a few more discs, and they want to fuse me. Is that something that's typical to get done as far as the fusions go for lower back?
It is a common procedure to do. Typically, we will think about spinal fusions to treat spinal instability. So the first thing, again, is to understand what the problem is. Is it a problem of nerve compression that needs to be unpinched? Is it a problem of spinal instability where the vertebrae are not steady and need to be stabilized? Or are both problems present? And does a person need both a decompression surgery and a fusion surgery all in one? So that's determined by listening to the patient, understanding their symptoms, doing a physical exam, looking at various diagnostic studies, and then we come up with the proper solution.
So we talked earlier about stenosis, because that's something I was diagnosed with, and I believe it's something that's pretty common that you've run into. What are some of the issues with stenosis over the years, and what does it actually mean? What is it?
Spinal stenosis just means less room available for the nerves. In the low back, the lumbar spine, spinal stenosis can involve the central part of the spine where all the nerves are being pinched. That typically causes pain in the legs, worse with standing and walking, better with sitting or leaning forwards. Stenosis can also be affecting just one nerve as the nerve leaves the spine, say from a bone spur or a disc herniation. And that might cause pain traveling down just one leg, may be associated with numbness and tingling. Those are problems that can sometimes get better non-operatively. We can treat that with medicines, injections, physical therapy. But when symptoms are persisting beyond 6 to 8 weeks or longer, sometimes surgery can be considered.
One of the other things, I haven't really even talked about this is something I found out not that long ago, is I had numbness in my hand and all kinds of things going on, and now it turns out that I probably have a herniated disc in my neck. I'm going in for an MRI at the end of this month to figure it out. I went through a nerve test, and it was inconclusive, so it wasn't carpal tunnel or anything like that. I'm sure you see a ton of this as well as far as the neck and the upper spine. What types of issues do you typically see with people coming in?
Well, people with arthritic changes in one part of the spine may be more likely to develop arthritic changes in other parts of the spine. So you've had lumbar disc degeneration, spinal stenosis, you've been dealing with that in your life, and it's not too surprising that you've also developed some arthritic changes.
You're saying I won the lottery, yeah.
Unfortunately, in some ways. Not surprising you have some cervical spine, you may have some cervical spine issues. And when a person has pinched nerves in the cervical spine, spinal stenosis due to disc herniations or bone spurs or both, then you can develop pain, numbness and tingling, traveling down the arm. In more dangerous cases, if the spinal cord is pinched, a person can develop loss of balance, clumsiness of the hands and fingers, even paralysis.
Dr. Oren Blam joining us here on the fixers, and I want to get your take on like some of this stuff. Is it hereditary? Do you find different cases where you see it kind of runs in the family?
The short answer is yes. It's a universal phenomenon that every human being will get wear and tear in their bodies, including wear and tear degeneration in the spine, but getting it more severely and perhaps in an earlier age may be related to genetics, also related to lifestyle. Folks who have played a lot of rough sports in their lives, football or otherwise, certain occupations may develop wear and tear more rapidly. Smoking also accelerates the degenerative process in the spine and other joints.
So the different types of surgeries that you're involved with, I guess each situation is going to be different, what it could be preventative of and what the outcome could be as far as movement. Do you see any restrictions there depending on what you have done?
Well, certainly. If we only need to do a decompression, if the nerves are pinched in the spine but there's no spinal instability, we may not need to do a spinal fusion, just either remove a disc or do what's called a laminectomy, removing bone and bone spurs from the back of the spine. If we don't need to do a fusion, just a decompression, a person may not develop significant instability. Alternatively, in some areas, for example, the cervical spine, nowadays we can do disc replacements instead of fusions. That allows us to take pressure off the nerves and stabilize the spine, but maintain spinal stability with a disc replacement as opposed to a fusion. So there are newer options that may maintain flexibility.
So when you first started to now, how much difference do we see in medicine? Because it's consistently getting better and better. Surgeries are getting better and better. The options are there. Have you seen a big difference from when you first started now?
Absolutely. I mean, there are certainly oldies and goodie procedures. Some patients, unfortunately, have significant problems that need big open procedures. But over the past 20 years, I've seen more and more, and I've performed more and more minimally invasive procedures that we just didn't have when I was starting out 20 years ago. So the minimally invasive arena for spine surgery has exploded. And also the implants, like I said, we have disc replacements instead of fusions in some cases. It's called motion preservation spine surgery. So there are many more options nowadays than there used to be.
See, when I first injured my back, they suggested a disc replacement, and then I put it off for so long that with the other damage I have and with the knowledge that I have stenosis, I was recommended to get a fusion. Mm-hmm. Is it, like, I was told to wait by certain people, like, hey, it's a better idea to wait to see, you know, medicine's going to get better, to see how much longer you can go without getting under the knife. But in some situations, maybe it is better to get the surgery earlier?
I think it's a tough decision. It requires a really careful conversation with the patient and the doctor to really understand where you are. Is your pain livable? Is it manageable? Maybe to suppress the symptoms, maybe not fix the problem, but suppress the symptoms with physical therapy, medications, maybe spinal injections. Or have you reached a point where the pain is unmanageable and a person feels debilitated, they can't live the life that they want to lead? There's no need to remain in misery when we have a potential solution like surgery. So it's a careful analysis or decision that the patient makes along with the doctor.
What are some of the most common things you see that people come to you, ask you questions about?
Well, neck and back pain, which we frequently treat non-operatively. When we talk about surgical problems, probably most commonly folks have disc herniations with pinched nerves, either in the neck or low back. Fractures are becoming common as people are growing older and more so than in the past, and yet remain active in their lifestyles. Their osteoporosis may predispose them to getting fractures. So we have minimally invasive surgeries to address fractures now. It's called kyphoplasty, where we can inject cement into a broken bone. So that's pretty common. And then folks with spinal stenosis who need laminectomies or even fusions.
So for the person that doesn't understand a herniated disc, what's actually happening with that to cause the herniation, or what is it actually? Because I think people always say, oh, I got a disc issue, and there's different levels of it, I'm assuming, as well.
Well, the disc itself is a shock absorber between the vertebrae. And like every other part of the body, as we age, the disc degenerates as well. It loses some proteins, it changes its protein mix, it changes its characteristics, it becomes stiffer. Many times that's asymptomatic, painless. But As that process goes on, the ligaments around the disc kind of get ruptures or tears, the disc itself fragments, and sometimes a piece of disc may pop out of its normal location and be taking up space in the room where the nerves want to be. So the nerves get pinched, pushed out of the way and pinched, and that can lead to pain in the back, pain shooting down the legs. That's what a disc herniation is.
So that's the sciatica down the leg?
The sciatica is the symptoms of pain, numbness, and tingling traveling down the leg because of a pinched nerve.
So if people have issues and they want to come find you, where can they find you?
Well, my group, Orthopedic Associates of Central Maryland, a division of Centers for Advanced Orthopedics, we have several offices in Catonsville, Eldersburg, Columbia, and I circulate through all three of those areas.
Yeah, it seems like a one-stop shop. From doing this the past couple of times, we talked to a bunch of different doctors from various backgrounds, also like, you know, looking at the different things that they take care of, that no matter what your issue is, you can come in and you'll find somebody that can take care of you.
It's important not only to make it convenient, but it's also important for the doctors to understand how to treat different parts of the body. Like you said, with your pain and numbness in the arm, it could be a pinched nerve in the neck. It may be looking like that, but we didn't know from the get-go. It could have been carpal tunnel syndrome. It could have been a pinched nerve at the wrist or elbow. It could have been some other problem. So we have doctors who can take care of many different problems that where the symptoms overlap, and we need to be able to understand what the problem is in order to choose the right solution.
Dr. Oren Blam, appreciate you joining us today. Orthopedic Associates of Central Maryland, Division for the Centers for Advanced Orthopedics. You can go to mdbonedocs.com to find out more information. Thanks for watching The Fixers. Enough time? Did I screw up your name on that when I first did it?
No.
Okay.